Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist. As part of my practice, I perform cataract surgery. Cataracts are dirty lenses inside the eye that nearly everyone will develop over time. And when I see my patients for a cataract surgery consultation, we talk extensively about the risks of cataract surgery, including complications, prolonged inflammation, and infection, as well as the risk of needing additional surgery as a consequence of cataract surgery. However, there are so many possible complications and side effects that can come up after surgery. So in this video, I want to reveal to you the 5 things that you might want to know about your eyes after cataract surgery that your cataract surgeon, including myself, probably did not tell you before your surgery. Everybody has some degree of dry eyes after cataract surgery, and 42% of patients in a survey study reported dry eye symptoms after surgery. There are many reasons why. First of all, the eye drops that we use after cataract surgery typically include bottled drops with preservatives that can dry out the eyes. Also, inflammation is very common after cataract surgery. Inflammation on the ocular surface is a very common cause of dry eye in general, and this type of dry eye typically gets worse after you stop your anti-inflammatory eye drops a few weeks after surgery. Finally, some of the cornea nerves are cut during surgery, which results in a loss of cornea sensation. Corneal sensation is responsible for promoting tear production, causing the blink reflex, and producing growth factors for healing. Droopy eyelids, also known as ptosis, is an overlooked side effect of cataract surgery that can occur in up to 21% of patients after surgery. Sometimes droopy eyelids are a reaction to dry eyes, which develop after cataract surgery and resolve as the eye goes back to normal. But sometimes this droopiness can be persistent. Permanent ptosis is most likely due to the eyelid speculum that we use during cataract surgery to open the eyes that, while necessary, can stretch out your eyelids. If you already have droopy eyelids, cataract surgery will make them worse. If you are considering eyelid surgery, you will want to postpone this until after you have cataract surgery. If you need a temporary fix before eyelid surgery, you can consider Upneeq, a daily eye drop that can help with droopy eyelids for short-term results. A common cause of patient dissatisfaction after cataract surgery are unwanted optical images, also known as dysphotopsias. You can have positive dysphotopsias, which can look like an arc of light on the side of the vision, or a negative dysphotopsia, which is a shadow or darkness on the side of the vision. These are related to the design of the lens that is put in the eye to replace your cataract, and while our lens designs improve every year, many patients still experience this. For the most part, these symptoms can disappear weeks to months after surgery, and while bothersome, most people learn to adapt to this phenomena. If your dysphotopsias are bothersome and disruptive, your doctor can consider various pupil constricting eye drops or thick-framed glasses, and very infrequently, your doctor could consider exchanging the lens to a different type of lens. But this type of surgery, called an intraocular lens exchange, is extremely risky and must be approached cautiously and as a last resort. Floaters are extremely common, more common than you might think, and often appear more often after cataract surgery. There are quite a few reasons why you get floaters after cataract surgery. If you have not undergone an event called a vitreous detachment, which is a separation of the vitreous or jelly that fills the inner part of the eye to the retina, the vascular wallpaper of the eye, you certainly will after surgery. This event frequently causes floaters and puts you at a slightly increased risk of a retinal tear or detachment. Another common reason for floaters is that after surgery, eye inflammation inside the post-surgical eye can also appear like floaters in your vision and may cause a temporary increase in spots. Everyone develops some degree of scar tissue behind the new lens inside the eye, and 30 to 50% of eyes end up requiring a laser to get rid of this tissue. This can start to appear as early as the day of surgery to many, many years later. This scar tissue is also called a secondary cataract because symptoms are very similar to cataracts. The first symptoms are nighttime glare, decreased quality of vision, followed by overall blurry vision. Thankfully, treatment is quick and performed using a laser called a YAG laser and works instantaneously. Once you have this treatment, you never have to have it again. I hope you found this video helpful.